I'm here with Agim Hymer at First Bite Dental. Agim is the proud owner of a KaVo OP3D two-dimensional pano with Ceph as well. This is the Ceph attachment, and the little arms fold down there. Does quite a bit, doesn't it, Agim?
Yes.
It's got everything on it. So I'm just sort of here, just catching up with Agim, just to have a sort of quick chat with him about why he wanted a CBCT in his practice in the first instance, and a few questions. So, Agim, why did you want a CBCT in your practice?
Well, we started doing many years ago, because this is actually my third machine, and just when we started doing implants, I was back then, before we had the CBCT, we were doing implants. We could work out the height of the bone, but we couldn't work out the width of the bone.
Wow.
So we'd have to pinch test it. And implants back then were the only thing that we had abort. Like, abort the surgery because there's not enough bone. So I just got tired of guessing the width of the bone, so it was time to move on to get a cone beam machine to help me with implants.
Yep.
But since then, it has so many other possibilities. We do orthodontics, so we can see how much bone and impacted canines, and a lot of oral medicine and endodontic diagnosis, etc.
Okay.
So it's opened up a whole new world.
So obviously you started initially just with the implant aspect, but probably realised that the best benefits were a lot in the general sense.
That's right. Yeah, just diagnosing, because 2D images don't pick up the whole image.
Excellent. And what can I ask you, as a good client of ours, what are the reasons that you chose Australian imaging and the model that you chose here, the KaVo OP3D system?
Well, for me, it's several things. One, the technology, and because I lecture for progressive orthodontics, I've got access to people who study these kind of machines.
Yep.
And so I just rang up that person who practices in Amsterdam, and he immediately told me, "Agim, you have to get a KaVo." So that was the first thing. Then I didn't have to question it.
Fantastic.
Then the second thing was price, and the company came up with a price that we found was reasonable and acceptable compared to other companies. And the third most important one is servicing, because that's probably gone down a little bit in the industry. So it was great to find a company whose friends of mine who are dentists said that the servicing from Australian Imaging was excellent, and they're always there and they're always helpful, and we haven't been let down yet either.
Thank you, Agim. I appreciate that. And how's the technology been received by the patients in the practice?
Well, the patients love it. Like, we've got lasers, we've got omnicams, we've got everything here. And so the patients really think that we're an advanced practice because we have everything here. And they also love the convenience, because no one's got time nowadays to make appointments to get an x-ray and then come back again to have that x-ray diagnosed and spoken about. And we can have it all done in one hit and speak about it within 2 minutes.
And what has it meant to the practice, I suppose? We touched a little bit clinically before, but commercially, has it made an improvement to the operational, of the business, the operation?
Well, everybody always talks about how many images you have to take to pay for the machine. And the machine's always paid for itself over a few years' time. But everyone forgets the diagnosis that the machine actually does, which means the machine like this will pay for itself within 6 to 12 months. So that's
just off the work that you get from the machine, from the diagnostic.
Exactly. But if you're going by per image, it does pay for itself within 2 to 3 years easily.
Yep. And I hear this, and I don't know if this is an accurate statement. I hear that it can make a bit of up to 20% difference in terms, 30% on the bottom line of a practice that invests in the technology. Has that been your experience, or not really?
Well, radiology clinics that medical practices use are the most profitable practices there are out there. So why not add a radiology clinic into your own clinic instead of giving it to another place?
That makes sense. And any tips for any potential dentists looking at systems, looking at this sort of technology?
Well, it depends on what you do in your clinic. If you do orthodontics, well then you definitely need the cephalometric arm on it and the AP Ceph, etc., which we got. But if you're not doing the orthodontics, then I would certainly get everything else. So it depends on what you're doing clinically.
And the field of view on the system is good with its adjustability. You've obviously got the top of the range OP3D here with the 4 fields of view, the 5, 5, 6, 9, 9, 11 and 9, 14. You can see obviously your TMJ, your airway, and you've not been restricted to anything that you can see or want to see as a clinician. That pretty much covers everything here in the practice.
Yeah, well, one of the topics I lecture on is TMJ, so I certainly need to be looking at my TMJ images as well. So that's why, because I do that clinically, I needed the bigger image as well.
Yeah, excellent. Well, Agim, thank you very much for your time, and our the video testimonial gives you a bit of experience with owning the unit now, and appreciate your time this evening. Cheers.
No worries.